Hiya, I'm Judy, obstetrician, gynecologist, and fertility specialist. One of the questions I often get from my friends and relatives would be what is important in early pregnancy? When I see a woman in early pregnancy in my clinic, what is important? What do I do? First thing, I will take a story. I'll ask, look, have you been fit and healthy? Any operations in the past? Any illness in family, etc., etc. And then after that, we need to make sure the dates are correct as well. Has she had a scan? Or some patients come to me with their first ultrasound scan done by myself, which is totally fine. And then after that, we make a plan for the pregnancy. The other question I often ask is this natural pregnancy or is this IVF pregnancy? IVF pregnancy, we definitely know how long this pregnancy is because we know the age of the embryos going back inside the womb. Natural pregnancy, many patients would know when did they ovulate or the time of where they conceive, and we can confirm that with an ultrasound scan. And then after that, women often get a package, folders, bags or something to bring home, which is very exciting. I'm going to show you a few, what do I do today. Some of them are quite standard for a pregnancy care. Some of them will be personalized, could be different from hospital to hospital, could be even different between specialists. I'm going to show you in a minute. Right, ladies and gentlemen, I'm going to show you what my patients get in their new pregnancies. Firstly, a bag from Bounty bag from Baby Bunting. We ran out of it for a little while due to the lockdown. Now they are back in stock. And after that, I give my obstetric patients a copy of the book. This is a book written by myself. Sorry, I'm just flipping through. You can buy them actually from bookstores and from Amazon. You can check it out in my web page. But yeah, my obstetric patients will have a copy of the book. I thought at this time I can use it to show you the plating for Mediterranean diet. Lots of whole grains, lots of vegetables, good fats, fruits, legumes, big proportion of fish, and then you got the meat, the poultry, red meat, and dairy. So there are many other recipes and different things and tips for fertility and pregnancies. So yeah, my patients will get a copy. Of course, this is exclusive. This is a folder. I give it to my patients. I have to say I get it from the stock photos from the interweb. I quite like the idea of flowers and then this nurturing this little butterfly. Eventually it becomes a beautiful butterfly. You can let me know what you think. It's not permanent in future. When I order new folders, then of course I might change the design. This is Cox. I work with Dr. Ken Nathan in Mount Lawley. Of course now I have expanded to Subiaco as well for the obstetric. Now what's inside? Those are the paperwork. Firstly is the non-invasive prenatal testing. It can be called Generation, can be called Harmony. There are a few different tests. First two columns. First one is the more basic test ones. Second one is the check for a bit more rarer genetic conditions. At the moment, I won't recommend to do this one because of locked down the transport to. They have this one. They have to send it to Sydney. I think Sydney or Melbourne. I think Sydney. With the lockdown, transport can be a bit slow. At the moment, I recommend to do the a bit more basic ones. So inside the pamphlets. The second two columns is carrier screening, for example, cystic fibrosis or certain genetic conditions being carried in the potentially being carried in the mums or the dads, where I have a patient sitting there. I spend a couple of minutes to explain more what does it mean, what's the implications of the test. which I won't spend too much time today. It's a different topic. So inside have pamphlets for different non-invasive prenatal testing, harmony, generation, and the carrier screening, which I've mentioned. The harmony test or generation test can do it from 10 weeks, as I mentioned. This is the form for it, generation test. And in my previous videos, I did talk about my patients. I do an exclusive Precious Mums Pregnancy Care. So for my patients, they have a copy of my book, which I've just mentioned. And also there will be, I give my patients yoga membership for 3 months, which I paid for. Again, it's exclusive. And also for patients with insurance, that have insurance, which most of you have, I give personalized dietetic service, physiotherapists. When you see them, they will swipe your card. But for my patients, usually there's a gap of $60 to $100 and such, roughly. For my patients, I pay for them. Because I want my patients, apart from a high quality medical care, I want them to have very good experience and comprehensive service so that they are well looked after in their pregnancies. Psychological care is quite important in pregnancy as well, so I encourage my patients to fill in those kind of a brief questionnaires about the mood, the psychology, well-being. It's not compulsory, certainly. If they don't feel like filling in, that's totally fine. This is the growth chart which I use for all my patients. Some units or some doctors only use them occasionally for higher risk pregnancies, but sometimes it is so important that we detect any potential problems very early on in pregnancy. That's why for my patients, all of them, I monitor the growth of baby. If there's a problem, we will see them as early as possible, which is very important. I've done a video in the past on it. You can refer if you need to. Some research. This is a research, preterm birth prevention, looking at probiotics, prebiotics, and also antibiotics to see whether we can do anything more to reduce the chance of preterm labor. It's a very good study, so I encourage my patients to be involved. They can contact the research center. Cell care, cord blood banking. It's not compulsory. I spent a few minutes to talk about it. This is the hospital registration with St. John of God, Mount Lawley of Subiaco. So it's done online nowadays. Last but not least, this is a schedule. Just briefly, we don't have to stick to it many times. And our contact number, the numbers for Subiaco of Mount Lawley. Now, the most important thing among all those is I always tell my patients the most important take-home message is that our team is always there. Email me, call me, or call if there's an emergency. You can call the family birth unit. So we will attend to you as soon as possible. It is 24/7. Often I make urgent appointment to see my patients within the same day when they need to. Number one priority is you come into our care, we will make sure that we are available 24/7. And more than often, I see my patients personally from that sense. All right, that's about it. See you next time. Bye.